At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Once again, folks, welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and each and every Friday and Saturday we get together and we talk about all things related to your health. And today I have, I want to say, a multitude of information-driven people. They are definitely going to talk to you about something that I think you should be aware of. Now, this is the proposed pharmacy bill. Now, you may say, what does that have to do with me? Well, it's very, very clear and very, very simple. This is going to be affecting how you literally received all of your medicine here in the Cayman Islands outside of the hospital. Would I be correct in saying that? Kind of a generalistic term, but if you can kind of clarify it and talk to them a little bit more about what it really details.
The pharmacy bill.
Yes.
Okay. Good afternoon. So the pharmacy bill is a new piece of legislation that is going to take the place of one that has been around since 1979. So it's over 40 years old, the current piece of legislation.
Mm-hmm.
The other thing is that all of us at some point in time take medicines. It's used in all healthcare settings, and we all seek medical care, and at some point we have to get medicines. So we want to ensure that there's good pharmacy practice.
Exactly.
One, safety of the public, protecting the public. So those are paramount in this revised piece of legislation.
Mm-hmm. And with that being said, you just brought up 1979. Mm-hmm. A lot of things has changed since then. Quality, control. Also, I would say just new medicine in total, different classifications. I know in the last probably 10 years, more than 15 or 20 have changed specifications. Just being, dealing with kids. You have kids medicine and I go there and I'm like, okay, this used to be called so-and-so. So nope, we've got rid of that. So things have changed. And so this makes it more understandable and more accessible to us here in the Cayman Islands.
Correct, because we have to keep up with international practices, the best standards, and we're just creating at this point in time minimum standards of pharmacy practice, basically. Standards that must be ensured, and you can go over and beyond that. But this legislation will increase the level of pharmacy practice, maintain good practice, maintain good standards. We're introducing a licensing process, approval of license, different kind of provisions that we've introduced into the legislation just to ensure that there's a quality, there's a good supply chain, there's safety to the consumers, not just patients, but consumers, and medicines in general. Prescription-only medicines, pharmacy-only medicines in general that are sold anywhere. Yeah.
We have some other panelists here. If you can go ahead and introduce yourselves. And then I'd like to talk to you about what she alluded to, the standards that we're looking for, because as you said, we're entering into a global community and there are certain minimum restrictions and minimum standards that is held everywhere else. So if we can talk about that. Someone who is a part of I would say the community, and then we also have someone who's part of the policy making. So, Mr. Nick, I wanted to bring it to you, part of the Ministry of Health and Wellness here in the Cayman Islands. From the government standpoint, tell me a little bit about how this shapes up.
Thank you. Certainly. It is not just those issues that both Janet and Kamani have introduced us to, that it's old legislation, lots of holes, and the need for quality standards. It's also, or being able to adopt quality standards, because there's lots of good quality standards out there, particularly good manufacturing practice and good distribution practice, which are standards from WHO down, adopted in all countries. But also, it's looking at the opportunities that are available to us now, because it's not only the standards and the way that pharmacy and medicines move about and get used. But there's also a lot of other clinicians who have changed their practices and have developed over the last 40 years. 40 years ago, when this pharmacy bill came in, for example, it only allowed doctors, dentists and veterinary surgeons to prescribe medicines. That's still the case here. And yet, if we look around the world, we can see very successful models where other health professions have their own formularies, the list of medicines they can prescribe, and they can prescribe medicines so that they can treat the patients more effectively, don't need to be bouncing between a doctor and themselves. And a very good example of that, indeed, is the pharmacy world. At one time, pharmacists were trained in the elements of running a business and some of the science of the pharmacology behind what was happening. Now, many people studying pharmacy now around the world will also be trained as clinicians who can prescribe as well as dispense medicines. And so, we've got a lot of those people here in Cayman now, but they've come to Cayman and they've come from somewhere where they were allowed to see patients, they were allowed to treat patients, and they come here and they've lost their right arm. Okay. And so giving those rights and those skills, pharmacists, some specialist nurses, for example, emergency technicians, there's quite a number of groups who can have their practice enhanced, and patients can get more immediate care and can probably get care from the best person fit to do that care. Really good example, for instance, with pharmacists.
With that being said, sorry to interrupt you, but as I keep hearing it, this is really a benefit for the community, versus a benefit of just uptailing the standards in the industry and getting rid of old legislation. Because I would feel more comfortable knowing that the person I'm going to, that one person is able to do as much as they can do, versus me having to leave this person, go to a second person, tell them everything what I just told the first person, and they say, okay, well, you know what, because of that, now I can dispense this because the other person wasn't able to, but they were fully capable and understanding of what was going on.
Absolutely. Another good example for you. In many parts of the world, the everyday care of diabetics is done by a diabetic nurse specialist. And we do have some good examples of diabetic nurse specialists working in the Cayman Islands. They're able to see patients much more frequently. They can give the long-term care because they know a person over many, many years. And if they can, as well as doing the things like checking their bloods, checking the kidney function, checking the nerves, that the feet are working correctly, correcting the pulses, checking vision, all those things that should be done. And if they can look at the history of the recent diabetes and say, hey, we need to adjust your diabetic medicine a little bit, and they have the right to do so, it's done immediately, it's done reactively, and it's done in a responsible way by somebody who's a true specialist. These kind of things can add a lot to quality of life and can add access to care, which some people may not have.
Exactly. So this bill really clarifying a lot of loopholes that have been missing within our community. Would I be competent in saying that for everyone?
Yes. It's filling holes and it's giving future opportunities.
Exactly. Not just for the business model, but also for the community model, giving you more access and also quicker access, because there are times that I may not be able to. I think of many instances of people traveling, you brought up diabetic, maybe transportation is a problem from one location to another. They only need to go to one location and also have everything done there, get their medicine, see a clinician and do everything in one location. It's also faster and more responsible, because now we have one chart versus 3 or 4 floating charts because someone say, oh, I got to wait till we got to call so-and-so to get that information from them. It just makes more sense overall. So we're going to take a quick break and come right back, and we're going to talk to you about the next step behind this, which would be the proper handling and the supply coming in. I'd want to talk a little bit about that. You're listening to Healthcare Today with the HSA. We're talking about the new proposed pharmacy bill that's actually on the table right now. It went on, consultation was from September 29th all the way until November 30th. So we still have some time to talk about this. And if you want some more information, when I come back, I'm going to ask them how you can download the bill, and we'll talk about that. Keep it right here. This is BOBO 89.1 FM.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and as I said before, each and every Friday and Saturday, we talk to you about all things related to your health. And this time we're talking about the proposed pharmacy bill. I have some great people in the building here. We're going to talk to you. I'll let them introduce yourselves, and then we're going to dive right in back into the conversation.
My name is Kimani Blackwood, Chairman of the Pharmacy Council.
Janet Flynn, Senior Policy Advisor for Health with the Ministry of Health and Wellness.
And I'm Nick Gent. I'm the Chief Medical Officer for the Cayman Islands Government and the Ministry of Health and Wellness. Excellent.
So we were talking earlier about why the bill is so important. And we starting to see a clear indication of that, not just from the standpoint of us, but how we relate globally. I think everybody started to understand the idea of supply and demand when it comes to medicine during the pandemic, how important it was, and how standardized, and in some cases, how unstandardized, because a lot of places was like, oh, we're accepting this one from this location, and people were like, so what is the difference? Not bringing up old news, but it put a light to that there are different things relating, and everything needs to be on one understanding. So we're talking about that. Talk to me a little bit about the handling and the supply of the medicines that we have coming into the Cayman Islands.
So one of the things we're looking at is the classification of medicines. And we've had them in 3 different groups mainly. The prescription-only medicine, pharmacy medicine, and narcotics, which would fall under prescription-only medicines. And so we wanted to classify those to make sure there's a distinction between what's a prescription-only medicine versus what's a pharmacy medicine. A pharmacy medicine currently, well, not currently, but as the legislation goes forward, is a medicine that you can get without a prescription, but it's under the supervision of a pharmacist. Then we talk about monitoring and regulation of the importation. We are aware that there are lots of illegal activities and drugs that come in. So it's something that we're working closely with CBC. So the importation, the prescribing of medicines, and these are medicines generally from prescription right down. Distribution, wholesaling.
With that being said, and you brought up something real quick. If I'm border control or I'm working on the airline or wherever, I don't know what hydrocortisone, XYZ, I have no idea what that is or whether it's legal or illegal. So this kind of gives me a very brief understanding and also a name to say, okay, these are what falls under good that I can let through, and these I need to see some extra paperwork and also detail that from.
So you're wondering, how would CBC know whether? Well, unless they found you with something that exceeds commercial value.
Okay.
That's one of the concerns that they would have if you had something in your possession that doesn't have a name. They might ask you, if it doesn't have your name and you're carrying for somebody else, do you have a prescription from your doctor? Do you have a letter from your doctor? Because there is an allowance in the legislation that is being proposed for to bring in drugs for self-administration. But there are certain criteria that we've outlined in the legislation that will ensure that CBC doesn't harass you, so to speak, or CBC doesn't take it away from you. And usually if they suspect something, for whatever reason, they will usually refer, if I stand corrected, to the chief pharmacist of the Health Services Authority.
Okay.
Yeah.
Okay. But and that's good to know, because a lot of times people with health issues may be traveling, and we're talking more than hypoglycemic, different things. You may have nephrotic syndrome. You may have different things that will require something that they may not know what that is. And even though you may tell them, they'll be like, so it's a pink versus a white pill versus a green, So it's good to know that there is something kind of on the ground that can dictate to let them know, well, hey, this is what we're looking at here.
Yeah, and we're going to be working closely with them and make them become familiar with the legislation. Dr. Gent has already started some discussions with Customs and Border Control, so they're have a full understanding right now that there's this pharmacy bill and there are other changes to come in the regulations.
Exactly. Yeah. And so I'd like to direct this to the Pharmacy Council. They have businesses that do large imports for I would say retail usage. Tell me a little bit about how this affects that idea.
Okay, so what the bill also addresses, it addresses quite clearly the entities, the institutions, the organizations, and what would be required to be authorized to import medicines. So, for example, there is a provision now for licensure of wholesalers. So the bill does cover, who is allowed to import, what license you would be required to hold to be able to import. So that is also addressed in there.
Okay. And that's good, because I think Cayman, we have the benefit of having over the last few years more businesses that relate to the pharmacy because before it was literally, if you were sick in the middle of the night, you had to go to the hospital. That was almost the only place. Now you can have other places that are open, if not as often as 24 hours, close to it, that you can go, hey, I can go see them. Do they have access to medicine? That would be the next thing, because maybe I'm in pain and need some sort of relief and things like that. If you can talk to me a little bit about that, sir.
Yeah, I mean, the continuity of care services is absolutely critical. We do have to maintain some 24-hour services, and if somebody's in pain or symptomatic, there is the emergency department and the urgent care services that they can go to, and they are able to gain access to immediately necessary medicines. We have pharmacies, though, that do operate the whole week around and operate late and so on. So it's an unusual circumstance where somebody can't get a medicine they need, and it's probably because they've got an acute illness in the middle of the night. But that's what the emergency department and urgent care is for there. So that won't be affected. There's nothing in the bill which limits. Everything in the bill speaks to increased opportunities and access for in different ways. So I'd be confident that people can get the medicines they need and get them at the quality that they need. And I know another thing that Kamani likes to talk about is the whole way that we interact with the international system and traceability of medicines, so that we can be more and more assured that what we're getting isn't a fake.
Right. I was going to say that I watched a couple of months ago in folks, pardon my TV because I was late night, but they were talking about counterfeit medications and being able to track it from conception to source. And folks, if you could bear with me a second, they talked about the ID number from the manufacturing company all the way down to the nurse that was using it should match from the beginning to the end. Continuity. Talk to me a little bit about that from the pharmacist's point of view.
So I just want to just piggyback on the point that has been made about increasing access and the fact that the bill contributes to the increase of the opportunity for persons to access healthcare. But one of the things we want to make sure is that at 2 a.m., when you need that pain relief and you're able to access it, that it is actually giving you relief. That if you get a dose of a medication, it is what it is supposed to be, or it is not contaminated and causing other problems,
or anything,
or diluted. And so that is a concept that we have tried to weave into this new legislation. And the international best practice everywhere that meets minimum regulatory standards is ensuring that medications that are imported are able to be traced from the raw material, the procurement of the raw material, right through to the manufacturing process, how the medication was transported. For example, if the medication is to be stored between 2 to 8 degrees, or is supposed to be kept below 25 degrees, that is tracked and that is logged for transportation across continents, across seas, across oceans.
Very, very specific, because remember, folks, we're dealing with medication that may have a shelf life. It may deteriorate under certain conditions. It may need to be sustained at certain conditions, and so that's what we're taking a look at there.
Yes, and the failure to store them according to these specifications will, in effect, render that medication useless in many cases. And so it is something that, as professionals, pharmacists always consider, and the pharmacists that we have on the island always consider and always try to ensure that they get the information that they're supposed to get. However, that has not been woven into our regulation, and so this is one important thing. Just to add, we have encountered, just as most countries in the region and most countries in the world, we have encountered counterfeit drugs. Just a few weeks ago, we had counterfeit Ozempic being intercepted on the island.
Sorry to interrupt. Do you find that as the public become aware of these, I call them hot commodities. I remember there was a time, and folks, we do talk here. So when I say the blue pills from the early 2000s, 90s, and 2000s, you know what we're talking about. And that was all of the rage. It was on TV shows, it was on the cars, it was on everything. It was kind of men coming back to life situation, no pun intended. But all of a sudden, it was a wave of counterfeit there, and I remember distinctively in New York, they had like a ring that they busted with literally hundreds of millions of allegedly fake medicine. Do you find that as the public become more susceptible to, people, and I'm going to pronounce this wrong, Ozempic.
Yeah.
This is a drug that was originally found for diabetics, and it found that with proper use, you could lose weight. So all of a sudden now, a lot of people are aware of it, which makes it more compelled to be counterfeited.
Okay, so one of the issues that arose from that scenario is that because of the huge demand for the drug, the manufacturers were unable to meet that particular demand. We could discuss what led to that demand, but pretty much. So,
right.
There were news articles, there were notifications that came out about stock issues in the US, in Europe, and so on. And so once you have that demand, there are persons who see the opportunity to make some money, and whether it is nefarious or not, they're going to take that opportunity.
Right.
And so this is exactly what happened. The manufacturer, Novo Nordisk, has sent out information and guidance regarding how to spot counterfeits because they're aware of the problem. It's if you Google it right now, you'd probably be surprised. It is covering Europe, it's America, Canada.
Yeah, it's worldwide. It's
worldwide.
It's really worldwide. I've known people who were using that for other reasons, for the first reason, and they couldn't find it because all of a sudden it became a hot commodity, and everybody globally was looking to potentially use it for whatever purpose.
But one of the things that has happened in these countries is that because they have the regulatory framework, they're able to intercept and quite early and stop the proliferation of these counterfeits among the population. And that is what we're trying to do. In the Cayman Islands, we're trying to ensure that
our jurisdiction is as safe as can be. And folks, with information and knowledge, that's part of the growth with us. I mean, we are being. You'll be surprised to know how much people know who we are, what we do. So we are definitely on the radar for positive and for negative. We are a target by it. I know companies that have been hit with computer that cost them XYZ. So it would be frivolous for me to think that we would not be a target for illicit people when it comes to drugs here. And I mean the right kind of drugs, medicine here. So with that being said, I took and downloaded the copy of the draft. Tell me a little bit about that, the framework of it as total, and also how much time did this take you? Because we're talking changing something from 40 years ago to updating it to now. Now, mind you, I'm sure that there was a lot of back and forth and a lot of looking at it. But tell me in a nutshell, Mr. Nick, about that.
Well, I've been here a year now, and it's flown by. It's been a great, wonderful experience, and a lot of the work on the pharmacy bill had already been done at that point, but I know how much more has been done subsequently. And there's a lot of technicality that just goes simply with the legal drafting. The language has got to be precise, it's got to be exact, it's got to make sure it has the meaning and the import of what we're trying to do. So there's that interface between us as clinicians and the lawyers to say, get the language right, the precision in there, how this means, and so on. We've had to make sure that we hopefully don't need another bill for another 40 years. So we're trying to foresee the future and give flexibility in there so that the bill can reflect developing things. An example like I gave at the beginning, which is about allowing a whole new class of clinicians to be able to operate effectively, for example. But we also need to think about some of the lessons that we'd seen from the recent past, and COVID particularly. And whilst we don't have the ability to do the regulation of medicines right from the beginning, say that the US FDA or the UK MHRA can do, because they've got thousands of people working for them. This is essentially it for the Cayman Islands sat in front of you today that can manage these things. But so we've previously had to say, hey, if it's okay with the FDA, it's okay with the MHRA, then that's good for us. But we've found in COVID, it wasn't good enough because old medicines were being used with new purposes. New medicines were coming along faster than the regulators in those countries could cope. So we couldn't benefit from that. Hey, we'll leave it up to the UK and the US to tell us what to do. And so we've had to put in things like, can we have means of recognizing medicines in our own right, either because there's an urgent need, such as the pandemic, or there's some exceptional use, such as we have a patient who has a critical illness, an unusual illness, and we need to look to a research medicine to treat them because of the severity of that illness. So we've got things like that in there, which is giving much more local autonomy than there was before. But it's been about that, looking around at what best practices in a number of other countries, looking at what the gaps were here, but also having that aspiration that we can develop the healthcare service in the way we want it, And we don't find that we're hindered by not having got the right bits and pieces in the background and the technical issues of the pharmacy bill, because those medicines, virtually any kind of care that we're giving involves the medicine in some point of the way. Even if you think, well, I'm going for surgery, well, actually, you'll probably be having some antibiotics, you'll be having some painkillers, you'll be having anesthetic agents and so on. So medicine is the most pervasive thing. And one thing which is really, really uppermost in our minds is that the most avoidable mistakes in medicine comes from the accidental misuse of medicines. And so giving us a framework in which we can build a system for the future which enables us to have the best quality and the best safety environment around medicines is critically important. And that was very much in our minds when we were designing this bill.
Okay. We're going to take a quick break and come right back. Folks, if you're just tuning in, we're talking about the proposed pharmacy bill. Of course, this is on the table, and I want to talk to them a little bit more because we've talked about importation. We talked about the clarification. I wanted to come back and ask, what about the manufacturing part of it? If you can give us, I'll give our panel a little time to think about that. We'll be back in 2 minutes. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and we talk about all things related to your health. And this one is very, very important. We'll be back in 2 minutes.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Thank you so much for tuning in. If you've missed us, we've been talking about our pharmacy bill, the brand new proposed one. Of course, this is replacing the Pharmacy Act from 1979 and also the pharmacy, I guess it's poisons and restricted pharmaceuticals. This would have been like 2017, I think, somewhere around that time frame.
It was just an amendment.
It was just an amendment. Okay.
Yeah.
All right. So I have my panel here with me. If you can go ahead and introduce yourselves once again, and we can get the conversation started.
My name is Kimani Blackwood, Chairman of the Pharmacy Council.
Janet Flynn, Senior Policy Advisor for Health and the Minister of Health and Wellness.
And Nick Gent, I'm the Chief Medical Officer for the Cayman Islands Government in the Ministry of Health and Wellness.
So we were just talking a little bit before the break about I want to say the manufacturing and the handling of the medicine on island. So I do know, like, sometimes they may have to mix and match a little bit. Maybe you need some certain painkiller with a certain diuretic, things of that nature. Tell me a little bit about that.
Okay, so one of the things that Dr. Jane said earlier, which I think is quite moot, is the fact that we have to be thinking into the future while crafting new legislation, because we want to make sure in 30, 40 years it is still relevant. And so one of the things that is quite new and has been introduced by the bill is the manufacturing license. And this is where currently we don't have a big industry in the Cayman Islands as it pertains to manufacturing. But let's just say we have some curious young Caymanian who starts to do research on silver thatch and finds out that there are some compounds in silver thatch that can help with migraines. Mm-hmm. And then the research is revered, it's peer-reviewed, and we see that it is efficacious and it is safe, and we would like to manufacture that in the Cayman Islands. Well, then you would have a process through the Pharmacy Council where you may apply for a manufacturing license and then be able to set up that business, employ Caymanians in that business, and then supply that drug on island after it has been approved by the Pharmacy Council. And then also there's the opportunity for exportation. Mm-hmm. So that has been thought about and that has been included in the bill. As it pertains the extemporaneous compounding of medications, and that is where we're putting together, as you said, mixing this particular active ingredient into an ointment or into a cream base, mm-hmm. The making of suspensions and so on. That is something that falls under the auspices of your licensed pharmacists. We do have some specialists on island currently, but your general pharmacist is well trained as a part of their undergraduate training to do extemporaneous compounding, whether it be aseptic compounding, that's sterile compounding, or non-sterile. So that would continue to
Exactly.
to
Okay.
obtain.
Let me just toss an idea out there. We're a industry as well as an idea. Suppose there's call it I don't know, Tylenol company, and they want to come here and manufacture here in the Cayman Islands, open up a plant here, out in the eastern districts. And is that possible for them to do that under this new law that we're proposing here?
Yes, and under this bill, it would allow that. There's no limit on size or scope. It would be up to the company making the proposal to give us assurances that they could do it safely, could do it of the right quality, and there's all the other business licensing that goes with it.
Of course, there's a lot to it, but the idea.
This bill would allow that. Probably the more likely area that we might see things is the growth of personalised medicine, where we're not just looking at the nature of the disease, in the round, but we're looking at how that disease is affecting people individually. Very good examples, for instance, in treatment of cancer these days, we'll often use mixtures of medicines that very specifically fit enzyme markers for that individual and so on. And so being able to prepare and present those kind of medicines to maximise the outcome is also is also allowed for in this as well.
And with that being said, that brings me to kind of my next idea. The ability to say to the listening public, say, hey, we have this bill. How can they be a part of it? How can they take a look at it? How can they say, okay, you know what? Where can I have this conversation? Maybe email in some questions and things of that nature.
So the bill is on the ministry's website, ministryofhealth.gov.ky, and there is an FAQ, and there's a citizen's guide to guide you through the bill that you can read. It's broken down in simplified questions in response to the legislation. There's also an email address, mohfeedback@gov.ky. That's mohfeedback@gov.ky, where you can send your comments to us. And we will review those comments, and they will form part of our consultation draft.
And the end of the consultation is November 30th. When will the draft be voted on?
That depends on how long it takes us to pick up all those comments, and amend the draft legislation in line with them. And I'd have to say we're already getting some very high quality comments, really useful things, and I can see that there are going to be some very important amendments to the bill that we'll be then presenting to Cabinet for permission to go to Parliament and for it to be debated. So if we were being really, really lucky, we're probably talking about parliamentary debate Easter, end of first quarter into the second quarter of next year.
Okay.
And that's quick actually internationally for parliamentary standards.
Of course.
But yeah, I mean the kind of feedback we're getting is really good quality. It's going to be really easy for us to put that into the bill from the quality of the comments so far. So I don't think the consultation period is going to hold us up, and I'm very confident the consultation period is going to make us have a better bill as a consequence.
Understandable. All right, folks, we're going to take a quick break, and when we come back, I'm going to ask my guests to start wrapping up. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
And we are back, folks, as we get set to wrap up here. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking about the brand new proposed bill for the pharmacy. Now, I asked my guest to kind of put into thoughts what and why you should be concerned about this bill. And if you can go ahead and start with you, Dagmar.
Concerned with this bill, interested in this bill, excited about this bill from the stakeholders, from pharmacists to customers, patients. If you're a parent who has kids who you administer medications to, I think all of us in the Cayman Islands should have some interest in going through understanding what this new bill means. I think it is very important that we understand how it will affect the quality of the medications that we access. I think it's important that we understand, especially from a customer perspective, what this means for access to healthcare, what it means to, am I able to access this medication from the pharmacy with someone who's trained, someone who's qualified to provide this medication, or am I going to be delayed in accessing it by waiting for some other avenue? So I think those are some important things that this is one of the reasons I spent so much time working on this, because I wanted this standard. I wanted to be able to administer ibuprofen to my 8-year-old son and be confident that what I'm giving him is of high quality.
Of course. I like that from a parent standpoint and also a stakeholder standpoint, definitely. And Mr.
So this bill has been long awaited. Many hours, many years has been done on this bill. So it's really time. And as I stated earlier, we're all consumers of medicines at some point. And this bill, we aim to close many, if not all, the current gaps that exist right now. We wanted to ensure that those gaps are addressed and that this bill will not just serve now, but future generations to come.
Right.
So I am going to take this opportunity to encourage every person out there to provide their comments to the ministry at mohfeedback@gov.ky. Whether it's a single line comment, whatever it is that they have to contribute, provide us with your feedback and your comments. Basically, what you understand. If you need clarity or more information, we are also able to provide that once you email to us. So I encourage everyone to provide us with their comments. The closing deadline for the consultation period is the 30th of November. Okay?
Okay.
And for me, it's an opportunity for us to develop the healthcare services in the Cayman Islands, to take the best advantage we can of all the healthcare professionals here, give them the tools that they need to do the job as well as possible, and make healthcare more accessible and of the best quality possible.
Okay. And I'll just toss in my 2 cents from a concerned citizen. And this is for my people who, I love y'all, and we don't take action till after it's too late. We always have a comment after the fact. And that's my Caribbean people. I love y'all, but listen here. Every one of us at some point in time has to take some sort of medication. Whether you're young, whether you're old, whether you're in between. So wouldn't it be best that you knew what you were getting was of the highest standard and the highest quality? You would be able to say, you know what? I know that this came in through reputable sources and understand the realm of it, because we all figure out how to fly. We all figure out how to drive. We all have a concern about, it's so much cars in Cayman. Think of it this way. The medicine that comes here, how much do you know about it? How much should you know about it when you have to take it, some people on a daily basis? just a little food for thought for you. Make sure you go ahead and put in your consultation. It is until November 30th, so we have about roughly a month, but time will go fast. Can I get the website again, and also the email address?
Email address,
Yes.
mohfeedback@gov.ky, and the website is ministryofhealth.gov.ky.
Exactly. You can download the proposed bill. It's in a PDF form. You could read it. I just did it on my phone, and I'm able to see in the draft of it and be able to make comments. So you can do it either on your phone, your laptop, anyway, your iPad or your Samsung, whatever. Please go ahead and do it. And Cayman, as always, please take care of yourself. This is the first step to it. Thank you so much to my guest panel here for talking with me today. And don't be strangers. We look forward to talking with you again.
You're
Thank
welcome.
you,
Thanks
Chuck.
for having us.
Thanks
you.
for having us.